So I'm back with Dr. Robin Fackrell again to talk about sexual dysfunction in Parkinson's, an awkward topic for many people. So first of all, is it common to have erectile dysfunction in men with Parkinson's?
So erectile dysfunction can be part of the Parkinson's journey for some people. And as the journey progresses, it becomes more likely. Early erectile dysfunction sometimes makes us think of other conditions which affect the autonomic nervous system as well. But generally, yes, erectile dysfunction can be a problem for people as Parkinson's progresses.
And similarly, can difficulty achieving orgasm, difficulty ejaculating be a common problem for men as well?
Yes, that can be an issue that people experience, and that can be in part of that autonomic nervous system challenge, but also it can be a side effect of some of the medications that are being taken.
So for men, obviously, there are a number of drugs like sildenafil, the generic drug for Viagra. Is that normally effective with this type of problem?
It can be. Erectile dysfunction has different underlying causes, and for some people, helping them achieve an erection with sildenafil would be okay. I would always caution, though, that you should be evaluated by a medical professional, particularly when you have Parkinson's, before embarking on with sildenafil. And the reason for that is that the way that it works, it can drop the blood pressure quite profoundly. People with Parkinson's are often prone to having postural hypotension, and this can exacerbate it. So it can make things a lot worse. But that doesn't contraindicate it. It just means that we should ensure that that's not a problem. So I would really caution against people just buying it on the internet, for example, and have an evaluation with GP or their specialist.
So we're talking about men's sexual dysfunction. Are there equivalent problems in females?
Yeah. Sexual dysfunction is quite complex. There's the mechanical sexual dysfunction, and there's also the sort of intimacy challenges that people with Parkinson's and the emotional changes that can occur, which can affect intimacy and sexual health. In terms of the more sort of physical side of things, then things like anorgasmia isn't uncommon in females, and so that can be an issue for them. But I think when it comes to sort of sexual health generally, it is sometimes patients have difficulty with arousal, with intimacy, with the emotional attachment, and apathy sometimes. So lots of different symptoms can be involved, which make normal sexual relationships more challenging. And then you have the motor symptoms, which can sort of interrupt the normal flow of things, if you like.
Yeah.
So tremor and off periods and those kinds of things. But I think working with the multidisciplinary team, if you like, physios, OTs, psychologists, the specialists, the nurse specialists, and you can sort of work around things. It may mean that you have to be slightly more scheduled. And things aren't quite so spontaneous because of the way that medications work. But normally, I think we can find ways around things.
So we did a separate video quite a while ago, actually, on the sort of more emotional side of sexual problems, and so we'll put a link to that in the description. But yeah, just talking about the physical side, I guess. So the other problem, of course, is impulse control disorders, which can be a side effect of particularly dopamine agonists.
Yeah.
We've done a separate video on that as well, so we'll put a link into that. But are there any other considerations with sexual dysfunction? Any long-term use of some of these?
With long-term use of medications, yeah.
For example.
So no, I mean, these medications are typically, things like sildenafil, typically quick on, quick off, if you like. They don't last long within the bloodstream, and they have an effect, and then that effect wears off. So there's normally causes about shouldn't really be taking it very regularly, because that can be challenging. But generally, there's not a problem with ongoing use of it.